Great. So thanks all for joining the webinar today. My name is David Schleifer. I'm the Director of Research at Public Agenda. And today we're going to be sharing findings from Public Agenda's survey of the general public in New York State about healthcare quality. And this research was supported by the New York State Health Foundation. So I'll just tell you a little bit about Public Agenda, who we are. We're a nonprofit, nonpartisan research and public engagement organization, and our mission is to strengthen democracy and expand opportunity for all Americans. And one of the ways that we do that, one of the primary ways that we do that, is by elevating the voices of the public so that leaders understand what ordinary people think about issues that affect their lives, such as healthcare. So what that means in practice is that we do a lot of public opinion research, and we also do public engagement projects as well. As I'm sure you all know, low-quality care has really serious physical, emotional, and financial consequences for people around the country, and including in New York State. And with this project, we conducted a representative survey of adult residents of New York State, and our goal was to find out what ordinary people think about healthcare quality, what they think quality means, what kinds of information about quality they want, and what they think the state government's role should be in quality transparency and in holding providers accountable. So the research was released in November, and we now want to make sure that policymakers, payers, providers, advocates, other stakeholders hear what members of the public think, and that's why we're sharing these findings with you today. And certainly hope that you will take a look at the full report. I'm only going to be sharing some selected findings today, but the full report is available on our website. It's called We Can Do Better, and there's a link in this slide. So to start off with, we wanted to know whether healthcare quality is an issue that members of the public in New York State are concerned about at all. We hear a lot about healthcare costs, but we wanted to know whether quality is really on people's minds. And the answer is yes. So almost 60% of New York State residents say they worry at least somewhat about whether their healthcare will be high quality when they need healthcare. Including about a third of residents who say they worry a great deal about quality, and that's nearly the same percentage who say they worry about whether their care will be affordable, and for the insured, whether their insurance will cover it. So this was a bit of a surprise to us, but I think what this says is that people worry about the same amount about quality as they worry about costs. So quality is definitely on the agenda for people in New York State. You might be wondering what quality means to ordinary people who aren't sort of steeped in the work of quality measurement and quality improvement. We asked, and if there's any news here, it's that what quality means to people is fairly straightforward. So overwhelming majorities of people rated all of the aspects of quality that we asked about for doctors and for hospitals, as I'll show you in a moment, rated all of them as very important. So that includes that the doctor diagnoses their condition correctly, provides them with effective treatments and procedures, listens to them and explains things in a way that they can understand, and that the doctor treats them with courtesy and respect, involves them in decisions about their care, and only prescribes medications or tests that they really need. And I want to highlight this concern about only prescribing tests or medications that people really need. This concern about over-prescribing was something that came through really loud and clear in the focus groups that we did for this project. And I have to say, in groups we've done for several other projects in the past, people were very concerned about over-treatment, over-prescribing. They seem to attribute it either to doctors not really having time to do the work of really figuring out what was going on with patients, so they would just sort of prescribe, or they attribute it to some kind of suspicion that doctors stand to actually profit when they prescribe meds or order tests. The only aspect of quality that an overwhelming majority of people in New York State didn't rate as very important was that doctor's appointments start on time, but as you'll see, 50% of people rated that as at least important. Another 38% rated it as somewhat important. So it's pretty substantial, appointment starting on time, but it doesn't rise quite to the level of these more, let's say, clinical measures of quality. So I'll show you it's a similar story with the measures of hospital quality that we asked about. So again, overwhelming majorities of state residents rated all of the aspects of quality that we asked about as very important, and this includes really the basics, so that they don't get infections or other complications in a hospital, that the hospital provides them with effective treatments and procedures, few mistakes or errors, clear communication, being treated with courtesy and respect, and that the hospital is clean, quiet, comfortable, well organized. So as I said, there's not a lot of surprises here in what people think quality means. I think when we look at these questions about what quality means for doctors and for hospitals, we certainly see that it's really the basics that matter. But we know, of course, that measuring the basics and achieving the basics, infection control and eliminating errors is certainly no simple task. So now I want to share a little bit with you about, let me just advance to the next slide, about what kind of information people want. So keeping in mind what people said is important to them when it comes to high-quality care, only about a third of New York State residents say that there is enough publicly available information about the quality of care that doctors provide or that hospitals provide. So just over half say there's not enough information, and the rest don't know, which may mean that they haven't really tried to find out. So, but certainly just over half are saying that for doctors and hospitals, there's just not enough publicly available quality information out there. So how do people want to get information about quality? Well, one way is that they think doctors should talk to patients about quality when making referrals to specialists or when making referrals to hospitals. So one of our recommendations in this report is that doctors and other healthcare professionals need the right tools, the right training, the right information to be able to have these conversations with patients about quality. And I should say that a few years ago we did similar research for New York State Health Foundation about price information, and we found something similar, that most people in New York State and most people nationally said that doctors really should be talking about costs with patients when they get care, and actually as a result, we know New York State Foundation, Robert Wood Johnson Foundation have invested quite a bit in helping doctors and other providers have those cost conversations effectively. So here we see a similar phenomenon with quality information where people are saying they do want to have conversations about quality with their doctors. People also see a role for state government and for insurers in providing information about quality. So most people think it's at least somewhat important for the state government and for insurers to provide people with information about the quality of care that doctors provide and that hospitals provide. And you'll see here, as with the other slides, the red bars are doctors and the green and blue are hospitals. Black and Hispanic state residents especially say it is very important for the state government to provide information about quality, even more so than white state residents. What I want to emphasize in these findings is that we specifically asked in our survey, in these questions, about the importance of providing information about every individual doctor and every individual hospital. So we're not talking about aggregate scores across a plan or a network or a region. We're really talking about individual clinicians, individual hospitals. I know that's a big ask. I know it's a lot for the public to be asking of state government and of their insurers. Thankfully, I don't have to be the one to figure out how to make that happen. But I do think it's important to know that this should be considered a goal. People are expressing a desire for clinician level and hospital level information about quality. Okay, so what kind of information specifically is it that people would like to see? First, I'll show you about individual doctors and then about hospitals. So about 2/3 of people in New York State say that information about effectiveness, how effective a doctor's treatments and procedures are, and about how many medical errors a doctor makes each year would be very helpful to them in finding out whether that doctor provides high-quality care. Somewhat fewer say that it would be helpful to them to know how much time a doctor spends with patients, and even fewer, and fewer also say that it'd be helpful to them to see patient reviews. So this information, obviously, about effectiveness and medical errors, many different ways to measure that. But I think the big picture, the big takeaway is that people really do want this sort of what we might think of as clinical quality information for individual doctors. And similar story when we look at the kinds of information that people want about individual hospitals. So for hospitals, about 2/3 of state residents say that information about how many medical errors a hospital makes each year and about how effective its treatments and procedures are would be very helpful to them in identifying a high-quality hospital. Information about how quickly they can get care, patient reviews, also do rate as helpful to people. But I do want to emphasize that these sort of basics about effectiveness and medical errors really do seem to matter to people, and they do really seem to be things that people say would be helpful to them. So one of the, if you recall from the first finding, people in New York State said that they worry nearly as much about quality as they do about affordability. And if you read the report itself, you'll see we also found that most people do think quality varies, both across doctors and across hospitals in the area where they live. So taken together, this does suggest a real concern among residents of New York State about low-quality care. So consistent with these concerns that, low-quality care is out there and people want to avoid it, we do find that most state residents think that it's a good idea for New York State government to monitor the quality of care that doctors provide, and fewer, but still about 3/4 of state residents say that it's at least a somewhat good idea for state government to financially penalize doctors if they consistently provide low-quality care. And about 2/3 say it's at least a somewhat good idea for the state to financially reward doctors if they consistently provide high-quality care. So this isn't really a question about value-based payment, anything so specific as that, but I do think the idea here is to get a sense from the public about what they see as the state's role in ensuring high-quality care. And clearly there's a public appetite for monitoring of quality and to some extent for tying quality to finances. I don't think people necessarily understand how payment systems work. I think that's a lot to ask of people, but I think that the general idea here is that people do feel that payment or finances should be tied to quality in some way. And you see something very similar when we ask these same questions about hospitals. So most people think it's a good idea for state government to monitor the quality of care that hospitals provide. Most, although fewer, say it's a good idea for the state to financially penalize hospitals for consistently providing low-quality care, and somewhat fewer to financially reward hospitals if they consistently provide high-quality care. So again, definitely a public appetite for some version of accountability for the quality of care that doctors and hospitals are providing. So the report itself, concludes with recommendations. I'm not going to go into those in detail, but I do want to emphasize a few takeaways from this. And one is that people clearly see roles for state government in monitoring quality, in providing information about quality, and in holding doctors and hospitals financially accountable for quality. Another big theme running through these findings is the desire for information about individual physicians. And I know that that's certainly a challenge in terms of measurement and in terms of how to report information in ways that make sense to ordinary people and that won't cause physicians any more undue stress than they're already under, and that won't create additional administrative burdens. But certainly we do see from the public in New York State this desire to know more about the quality of care from individual providers. So with these big tasks ahead, let me see if I can, these big tasks ahead of you, I'm just going to remind you that this is just a sort of a few selected findings or highlights from the full report. You can find that on Public Agenda's website. If you go to publicagenda.org, just look for the report, which is called We Can Do Better. So I'm going to leave it there, and I am looking forward to your questions, comments, and finding out what you think about these findings.
So again, people should feel free to use the chat box if they have questions. David, we don't have any questions right at the moment, but we'll hang out and see if somebody comes up with something. Let me ask you, I have a couple of questions for you, actually. The report, you guys talked to 800 people about healthcare. What was the geographic range for those 800 people?
Sure, good question. So the survey is representative of the state, and we did, I don't know offhand, but we were careful about making sure that it's representative of all major regions of the state. I don't have the methodology in front of me to share that exactly, but one thing that we did do was we actually oversampled for rural residents of New York State or for people living in rural zip codes so that we could see whether there were differences between rural and urban state residents. We didn't see a lot of difference, but one area where we did see difference between rural and urban is that when we asked about awareness of quality variation, which is not something that I shared in today's presentation, but when we asked about how many people thought that there was variation in quality among doctors or among hospitals in the area where they live, people in rural areas fewer people were aware of hospital quality variation. We don't, in rural areas, we don't know if that's because they just have fewer hospitals to choose from, and so there really isn't that much variation or less variation there, or if they really just aren't as aware of variation as people living in an urban location with more hospitals to choose from. So that was really the major difference we saw between urban and rural in these findings.
Okay. I have a follow-up, and then there are a couple of questions in the chat box that we'll get to. One of the things we talk about a lot is healthcare disparity. What efforts did you guys make in the study to ensure that the 800 people you spoke to were representative of age, gender, race, and ethnicity?
Mm-hmm. Sure, good question. So this is a representative survey, so we worked with a survey field house that's their whole job really is to make sure that we're getting representation of the state in terms of all of those demographic categories as well as political affiliation. They set targets based on the census. They use a combination of phone and email survey modes to guarantee that. And we were very careful to make sure that we had enough people of color to be able to explore whether and where there were major differences in attitudes on some of these questions. The one that I highlighted was I think the only one that really stood out for us, but that Black and Hispanic residents of New York State, even more so than white residents, felt that the state does have a role in providing information about the quality of doctors and hospitals.
Okay, and this from the chat box. How many questions were on the initial survey?
How many questions? Good question. I don't know if I have a number, but it was about a 13-minute survey. But if you go to the Public Agenda website and find the landing page for the report, so look for Public Agenda, We Can Do Better, we have the full survey questionnaire there, and you can see every question and the responses to each question.
Okay, and people responded to just one survey. There wasn't a follow-up process or anything like that, correct?
Correct. So one survey, and people obviously we had, for nearly every question, we had a version about doctors and a version about hospitals. We asked about doctors and hospitals separately, and people randomly, they either got the doctor questions first or the hospital questions first.
Okay. Another question from the chat box was on what is the current policy as it pertains to the role government currently has around quality of provider care?
What is the role of policy? Well, I'm not. I think that's. I don't know that I'm the best person to answer that because
it's a very complicated process.
It seems complicated. I'm going to go back to the original slide. Hold on a second. So I'll just say that one of the motivations for us in pursuing this research, and I think one of the reasons that New York State Health Foundation was interested in us, supported us financially in doing this research, was that the state is in the midst of developing its APD, its all-payer database. That's supposed to be a database, or it is a database that pulls together claims data, including cost information, quality information across the whole state. And there will be a public-facing site coming out of the APD. I don't exactly know what that's going to look like, but I know that part of the objective here was to make sure that we get this report in front of the folks in Albany who are working on developing that APD so that they understand how important this information is to people in New York State and have a sense of the kinds of information that people would be looking for.
And certainly one of the difficulties so hospitals tend to be public entities, doctors tend to be private entities. Hospitals certainly have more oversight in terms of having the answer to the federal government for things like Medicaid payment, Medicare payment, and to the state for things like certificates of need, and then as well as meeting specific guidelines and outcomes. But I'm not sure, and there's always, every year there's always brings sort of a new flavor to how we're going to manage healthcare quality. And certainly patient-centered medical homes are part of that, and they all have quality pieces to them. But I'm not sure there's actually any kind of cohesive set of rules and regulations and policies around healthcare quality, and I think that's kind of what you were seeing in the responses of the people you asked the questions of, is they would like to see that these things don't exist. They would like to see them, and there's really not a mechanism at this point to produce that level of information because it's unfortunately we have a very complex healthcare system in this country, and regulating it and then getting it to do what we think it should do is a complex piece of work.
Mm-hmm. Yeah, I think when we ask that question about how important people think it is for state government to monitor quality of doctors and hospitals, if we had had a little bit longer of a survey, I actually would have liked to ask if people think that there is that kind of system already. I wonder if people think that there is a system in place already for the state to monitor quality. I'm not sure what the responses would have been, but I do think that the degree of complexity that those of us who work in this field deal with every day, people may not understand that until they sort of come face to face with it. I do think that one of the questions that this research raised for us is what people we asked about doctors separately from hospitals because in the qualitative research we did to develop the survey, we did have this feeling that people did talk about doctors and hospitals differently, and when it came to trying to write questions, good survey questions, it was very hard to kind of lump the doctors and the hospitals together into one question. But one of the questions that this research has raised for me is, we know that hospitals are really changing. Hospitals are purchasing physician practices. They have clinics in communities and urgent care in ways that they didn't before. Hospitals are playing all sorts of new roles in social determinants of health, et cetera. So I sort of wonder, as a follow-up to this research, what people think about, what people picture when they picture a hospital. Do they picture a building on a hill, or do they picture these sort of much bigger, broader entities that we know hospitals have become? So that for me is one of the follow-up questions that has really come out of this project.
Great. I see that Vanya has posted a link to the report in the chat box, so if folks are interested, they can scroll up or down to get to that link, and then that will actually get you to the report. We had a question asking, were you able to dive deeper into the types of clinics or, the types of hospital or systems, clinics, outpatient, urgent care, ID, and I think this is sort of addresses what you were just saying, the sort of ideal of what a hospital is.
Right. Yeah. So we really did, for in a short survey like this, relatively short, we asked about doctors and we asked about hospitals, which we know are kind of generalizations, or even, we know that there are a lot of other providers, certainly besides, there's a whole world of nurse practitioners and physician assistants that provide care, and certainly at the hospital level, many different forms that institutions take. For this project, the focus was really on doctors and hospitals. I would love to explore some of these other types of entities and these other really important medical professionals and try to gauge people's opinion on those types of providers and care settings as well.
Another question in the chat box, and that is, would you say that patients who completed this survey were aware of principles, theory, and the art of quality management in terms of their being able to be formally engaged in quality improvement activities within the healthcare system?
So it's not something we asked about. I would say, to the extent I want to, if I think I understand the question, I don't think regular folks spend a lot of time thinking about quality management, quality improvement, quality measurement until, maybe if they are confronted with health challenges, or maybe if they get really involved as a patient advocate, that may be a different story. But for the average patient, people are not. I don't think people are thinking about the principles of quality management, and in a way, maybe I think it's a lot to ask people to be engaged in that way. I think certainly there are some who want to get that engaged, but for the average person, I just don't think that's on the radar for people.
Okay, yeah, it's really kind of addressing that the role of are you a passive recipient of healthcare, or are you an active recipient? And the active recipient would be sort of pushing back at the system, saying, "Hey, I want to be involved in these things because this is my care that I'm managing." Whereas the passive recipient is the one that says, "Gee, you prescribed 9 things to me. I don't know whether I should only have 7 or 8 or 6," and then just sort of walks out of the building with that, and may be happy or unhappy with the experience they had.
Right, exactly. Yeah, we did see that. I mentioned that people in rural areas were more aware of hospital quality variation. We also found that people who reported that they're living with a chronic condition have higher awareness of quality variation among doctors. So essentially, most people statewide were aware that some doctors provide better quality than others, but people living with chronic conditions, more of them were aware of that quality variation, and that may be because through their experience and contact with the healthcare system, it has become clear to them how much quality can vary, and we don't know what that means for how exactly they deal with the system, and when and where they may do that pushing back. But certainly there is an association between awareness of variation and living with a chronic condition.
Another question is was there a comparative review of quality systems in other countries? And I guess I would add to that, if there wasn't, is that something you would like to see?
It's not something that was part of this project. Our focus is really on what members of the public think. That's our niche, is public opinion research. But there's a great report by United Hospital Fund that came out a year or two ago, and the exact name of it is escaping me. But if you download the full report, it's definitely it's one of the things that we referenced. And what they did was they sort of simulated the experience of being an ordinary person just trying to find out about quality online and seeing what they could find online. But I think that as part of that, they do sort of have a review of the kind of the bigger picture of quality improvement, quality measurement efforts. So if you download the report, you'll find it in there. It's the 5th footnote. I think it's actually, the name of the report from United Hospital Fund is Empowering New Yorkers with Quality Measures That Matter to Them. So you'll find a link to that in the Public Agenda report.
Great. And I see that Frank has also just put up a link to another report that's in the chat box. Looks like new survey looks at patient experiences with medical errors. So that's in the chat box as well. Any other questions? Those are all the questions that have been put into the chat box to this point. And we'll give people a chance to type something in. While we're doing that, David, I want to say thank you for taking the time out and for sharing this with us. The report was sent to me by somebody who thought we would be interested in it, and then when I went through it, I said, "Oh yeah, this is something we definitely want to bring to the New York Links group." We talk about this a lot in New York Links, and certainly the interface between system and patient, and how to make the patient experience a better one. it's we all understand that a patient who is engaged in their own care or engaged with the system has better health outcomes than the patient who is not engaged. And the question is, how do you do that? And certainly if people don't feel like they're getting quality health care, then they have no reason to be engaged with the system. We don't have any other questions yet. So, David, is there anything else you'd like to add, right, as sort of a closing remarks or closing statement besides the ones you've already made?
Sure. I'll just add, so there's just one finding that is in the report that I didn't get, just because limited time I didn't highlight here, but if you do take a look at the report, one of the things we asked about was about the sources people would trust for finding out about quality, and by far it was actual patients who are the source that the most New York State residents say they would trust if they wanted to find out about the quality of a doctor or hospital's care. So we know that maybe actual patients aren't going to be the ones to have data on infection rates or error rates, but there is a high degree of trust that people place in actual patients, and that's one of the things, again, as we think about how to build on this research is sort of we're wondering, well, what are people actually talking about? What are people asking about when they ask actual patients? What do those conversations look like? So that's one of the questions we're starting to think about as we think about how to build on this research. But you'll find that finding in the report itself, which I believe Vanya has chatted on the website.
Yep.
Excuse me, included in the chat box.
Yep, great. All right. I don't see any other questions, so given that, we'll get to the point of closing things out. We always end our webinars with information about what's happening with NYLinks, what's coming up. So we always start with where we're at, and so we start with December 20th. This webinar is top on the list. January 27th, we have a Central New York regional meeting. January 29th is our next webinar, working with the TCN-CNB community that's coming out of Long Island. Northeastern regional meeting is on March 17th. TCQ Plus, which is training consumers on quality, which is really kind of the nuts and bolts of quality, how to read charts, how to look at, we're teaching basic numeracy, and sort of helping people get to the point where they can feel comfortable asking questions of the system. And then the Long Island regional meeting is scheduled for March 31st. These are just the meetings we have at the moment. We'll fill this calendar up quite a bit. We expect to have 8 other regional meetings between January and March, and we're shooting to have our webinar series produce 2 webinars each month. So look forward to that. I'll say we have some folks on at this webinar who are unfamiliar name-wise, so if you would like to get notices about the NYLinks webinar series, please send me an email. We'll get you on a mailing list that'll get you the NYLinks newsletter, and also the webinar information. Contact information for NYLinks. NYLinks is a regional effort, so we break the state into various regions. Each region has a coach. Here's a listing of the coaches. I manage NYLinks, so I'm at the top. And our website's at the bottom, www.NYLinks, spelled out as one word, .org. And you can find all of our most recent webinars as well as all the activities we do on the webpage. So, David, I want to thank you for taking the time out and sharing this with us. I want to thank all of you who stuck with us today through our initial stumbles. And we hope to see you at a webinar or at a regional meeting down the road. Thank you all. Have a great holiday. We know that's coming up very soon. And thank you again for being with us.